Welcome to Modern Aesthetics, the podcast. Founded in 1992, Face to Face is a humanitarian and educational surgical exchange program sponsored by the Educational and Research Foundation for the American Academy of Facial Plastic and Reconstructive Surgery. Both in the United States and abroad, AAFPRS surgeons and other medical professionals provide complementary care to those who suffer from facial deformities caused by birth or trauma. To date, it is estimated that face-to-face volunteers have helped over 1,000 people worldwide. Face-to-Face also has initiatives to help victims of domestic violence and also to help soldiers and veterans of war.
We treated 34 patients. There were multiple procedures that we did, but 34 patients that we treated during the course of that time. But really the goal here is that, we can help individual patients, but if we can transfer our knowledge to our Ukrainian colleagues, then they can continue the work, in terms of helping, because there's so many people who obviously will need the help with that ongoing conflict.
That's Dr. Minaj Abraham, chair of the Face-to-Face Committee, discussing a recent medical mission trip with Face-to-Face volunteers. An interdisciplinary medical team of 16, including 6 AAFPRS facial plastic and reconstructive surgeon members, traveled to Ukraine to assist those with facial injuries suffered because of the Russia-Ukraine conflict.
One of our members, John Frodel, Dr. Frodel, who's out in Pennsylvania, had reached out. He had been involved with these medical missions to Croatia back in the day with the Balkan Wars there, and they had really made a big impact there. And he had the idea of maybe we could do something with Ukraine. And so he reached out to Dr. Moss, Corey Moss, who's the president of our Facial Plastics Academy, who then reached out to me as chair of the Face-to-Face Committee, and we started planning. This was several months ago. And we went through many meetings to set this up. Initially, we weren't sure if we could actually get into Ukraine because obviously it's an active conflict zone. And we were talking about maybe adjacent countries like Poland and Romania, where it would be safe. And then through this committee process, we got a number of surgeons who were really interested in helping. A number of them, by the way, of Ukrainian background, who were really interested in anything that we could do to help, the injured in Ukraine. So we then made contact with a Ukrainian aid organization called ROSM. It's actually the third largest Ukrainian aid organization based here in the United States. And they were able to connect us with people on the ground in Ukraine. Specifically, we made contact with Dr. Ivanka Nibor, who is currently in the United States. She's a Ukrainian trained physician who set up this organization called Ingenious, which has the goal of helping educate people in Ukraine, the medical staff in Ukraine. And so through that connection, over the course of a few months, we actually heard that it was we could make a trip into Ukraine in a safe fashion. And then that's how the ball got rolling. And then, again, once we established that we could actually travel into Ukraine and help people with facial injuries and provide our expertise, then we started to consolidate a team and ultimately ended up with 15 team members. About 5 of them were facial plastic surgeons, but we also had a neurosurgeon. Maria Soroka, who's one of the founders of ROSM, was one of our administrators. Dr. Nibor, I mentioned, with Ingenious, she was really the linchpin connecting us to our Ukrainian counterparts at the hospital. Oculoplastic surgeon, so we had really all of the expertise that we needed to take care of injuries of the head and neck. Neurologist, Dr. Glenn Castaneda, joined us as well, and nurses and administrators as well. So a total of 15 team members. And then we partnered with, obviously, the people on the ground in Ukraine at the hospital, the regional hospital of Ivano-Frankivsk. Dr. Natalia Komashko is the ENT, the head and neck surgeon there, who invited us to that facility, and we had the invitation of the Ukraine Ministry of Health as well.
Once the team was in place, it was time to work out the logistics of traveling into an active conflict area and keeping everyone safe.
Initially, obviously, the concern was just to make sure that we would be in a safe place. If you recall, this is a time when they were having issues with the nuclear reactor there, and we were concerned about, if there would be some sort of issue with that and radiation leaks and things like that. So we really did want to pick a site that would be relatively safe. So we picked Ivano-Frankivsk, which is relatively close to the Polish border. And then the logistics, you're right, it was a lot of coordination between us and our Ukrainian colleagues. So we flew into Krakow, Poland, and then it was a bus ride from, you can't fly into Ukraine, obviously, because it's not safe. The airspace is closed. And so we drove from a hotel in Krakow to the Ukrainian border, which was about a 5 or 6 hour drive. And then at the border, there are trucks, cars lined up for miles trying to get through the border both ways, which is understandable, again, because obviously it's a conflict zone. So with the help of our Ukrainian colleagues, the Ukrainian Ministry of Health, they had arranged a green corridor for us, which still meant it took a couple of hours to get through, but it was expedited. And then there was another long bus ride from the border to a town called Lviv, where actually some of our team members had family or friends in Lviv, and so we made a pit stop there for lunch, and then finally got to a hotel in Ivano-Frankivsk at the very end of the day. So it was about a 12-hour journey from Krakow. Obviously we flew internationally to get into Krakow the day before. And it was interesting because when you're driving through, obviously there are these military checkpoints at the border, and then there's these barriers that are set up at the intersections, these metal anti-tank contraptions called hedgehogs, and sandbags and other things around buildings. So you are aware, even though this was on the kind of the safer side, on the western side of Ukraine, you're still aware that the country is at war. We would get these text alerts on our phone of extreme emergency, which in Ukrainian, so you didn't know exactly what that meant, but again, it related to missiles and other things that were being fired. Again, we took every precaution to make sure if we needed to evacuate, we could quickly, but it was clearly a country in conflict, even in the relatively safe areas.
Getting to their destination was only the beginning. The real work began when the volunteers arrived in Ukraine and met the patients and their Ukrainian colleagues. The team spent a week in Ukraine, treating patients injured in the conflict, some requiring complicated 10 to 12-hour-long surgeries.
We got there on a Friday night. The next day, we had a chance to meet the patients. We had pre-screened all of these patients, complex facial injuries. We were planning some, very complicated reconstructive procedures. So Dr. Niebuhr's organization, again, was really critical to that. She had, using her contacts in Ukraine, had these patients evaluated. So we were able to, online, through this database that the Facial Plastics Academy has set up, it's called the Connect system, we were able to review CT scans and photographs and histories, even video of these patients. And then we were planning some reconstructions using a kind of state-of-the-art 3D printed implants, for instance, to reconstruct missing parts of the facial skeleton. So we were able to do a lot of that planning in advance. But we hadn't really met these patients face-to-face. So that was the opportunity when we got there on that Saturday morning to actually meet these patients and talk to them about their procedures, adjust the plan as needed. And then we started to operate. And, again, it was really pretty intense because, again, some of these procedures very complicated all day, 10, 12-hour procedures, craniofacial stuff. We did microvascular tissue transplants, essentially. So for missing parts of the jaw, we can take the bone from the leg and reattach it to blood vessels in the head and neck to reconstruct jaws. So those procedures, again, are pretty long and complex. Took a lot of logistical planning to get all of that set up. So we would get to the hospital. So, after Saturday, we had a little break on Sunday to set up for our cases for the rest of the week. But Monday through Thursday, we would get to the hospital and wake up at 5 or 6 o'clock, get to the hospital by 7 or 8, and then we wouldn't leave the hospital till 10, sometimes later, 11 or 12. There's a curfew. You had to get done by 11 and to back to the hotel because they shut everything down. But there were a couple of nights that we actually were there a little past curfew. And so, really pretty intense work.
The team's work didn't stop with patient care. They were also there to collaborate with and train physicians in Ukraine so they can perform these kind of surgeries for other patients in need.
There was this conference that they had set up with over 130 Ukrainian medical personnel from all over Ukraine who had come to the hospital, and the procedures were live streamed from the operating room. So while we were operating, we were mic'd up. We could describe what we were doing, and they could ask us questions. So it was really a very educational, very interactive, collaboration with our Ukrainian colleagues. Clearly, we helped a lot of patients. We did 34. We treated 34 patients. There were multiple procedures that we did, but 34 patients that we treated during the course of that time. But really, the goal here is that we can help individual patients, but if we can transfer our knowledge to our Ukrainian colleagues, then they can continue the work, in terms of helping, because there's so many people who obviously will need the help with that ongoing conflict. And so, it's the idea of you can either give, a person a fish or you can teach them how to fish. It really is exponentially more beneficial to have them acquire the skills so that they can take care of these patients. And we envision this collaboration continuing. So we'll certainly plan on returning to Ukraine. But in the meantime, we're still in contact with our colleagues in terms of postoperative care on these patients and talking about how to take care of additional patients going forward.
There are so many who have been injured in this conflict. And as it continues, Dr. Abraham notes, so many more may suffer both physical and emotional injuries, including those actively involved in the conflict and civilians.
So that we did definitely treat a lot of patients. Obviously, a lot of the war injured are people who are actively involved in conflict. But unfortunately, there's been a lot of atrocities committed in Ukraine, and so there's I'd say at least a half of the population were civilians, even children affected by the conflict, and it's really it's really sad when you think about it. So. There's a story, for instance, of this patient from Bucha, which is that town close to Kyiv. If you remember, during the initial onslaught, they came into Kyiv, the capital of Ukraine, and then there were a lot of atrocities committed during that time. So she tells a story of being stopped by Russian soldiers. She was with her son. And they were shot. She was shot, I believe, in the arm initially. Her son was shot in the leg. She was trying to help her son, and then they shot her in the face, and then left her to die essentially on the roadside. And she talks about just being lucky to survive, losing a lot of blood, and again with this horrific facial injury. And then ultimately, was able to get to a safe place, but she was missing, a part of her jaw from that gunshot wound to her face. So, again, and there were a lot of stories like that. There, this young man with really a horrific injury of, burn to his face, missing a lot of the scalp, skin, and hair. Just recently, he had not been able to get in touch with his parents, who were in the eastern part of Ukraine, in the part was actually recently annexed by Russia and just recently liberated by the Ukrainian forces. So it's been 7 months since he was able to contact with his parents. And finally, he was able to actually, after we left, after this liberation of that territory, he was able to get in touch with his parents again. I did a procedure called a uriflap, where we transferred tissue from hair-bearing skin, essentially from the back of his head to the front, to give him hairline again. So it's really gratifying that we were able to help these patients. But some of the stories, unfortunately, are very tragic. There were tears, there were hugs. It was really emotional in that level. RASM, by the way, that aid organization, and Maria Soroka, they are setting up mental health counseling throughout the country, and I think that will really be necessary, because there's a lot of post-traumatic stress for everyone involved, and certainly the patients. And so that's clearly one of the things that will be needed going forward.
Face-to-face volunteers continue to be involved in post-operative care and patient management as well. This trip required so much collaboration, and Dr. Abraham credits the volunteers from Face-to-Face, as well as from so many other organizations, with making this medical mission a success.
Yes, the Ukrainian doctors there are excellent. Some of the skill set that we're bringing along, the expertise, they don't necessarily have, especially in some of the smaller towns and cities. But in practice, they're excellent clinicians, so they're certainly able to take care of a lot of these things themselves. And so the postoperative care, we've just been coordinating through them. Again, through WhatsApp, we can talk to them and exchange photographs and text, obviously, to manage patient care issues. Clearly, I don't speak Ukrainian, so I don't know if there would be a lot of utility for me to actually be talking to these patients, especially since everybody's doing great and healing up well. But it is great to be able to follow their progress and make sure that they're healing well, and arrange for anything additional that they may need. We're all volunteer, and I do really want to acknowledge that fact, because people are taking time out of their busy schedules, for essentially a couple of weeks, and losing revenue, obviously, and time away from family and vacation time, things like that as well. So it really is a personal sacrifice that each team member makes. But you're right, it's also a financial commitment. So we each paid for our airfare to get to Ukraine. But there were a lot of other pieces to this. You can't run a mission like this and completely self-fund. So we were able to, through the Facial Plastics Academy, raise a significant amount of funds through donations. An organization that I work with, Healing the Children Northeast, two wonderful nurses who were with us, Debbie Fritz and Sue Katijan, they raised a lot of money. Susan raised over $60,000 through Healing the Children for this mission, and that was critical for all of the supplies and medications, surgical equipment, instruments that we needed. And then clearly, big shout out to RASM. RASM is again, that aid organization that Maria Soroka set up. Her husband's a neurosurgeon. He's traveled extensively, and collaborated in Ukraine as well. He was on this trip, and so was she as an administrator. They arranged all of the logistics. So our hotel stays, the travel that I mentioned with the bus, getting us back and forth, our meals. So all of those were arranged through RASM. So it really was partnership. Ingenious, again, Dr. Ivanka Niebuhr's organization in terms of patient recruitment. And then clearly at the hospital, they had set up this conference called Storts, which is this endoscopic company, provided all the video and the live streaming for educational content. They shut down the hospital for that week, for us to do these cases in the ENT department. So, again, really a complete collaboration. It could not have been done without everybody coming together.
With so many more people needing help, there have been talks of another trip. In addition to volunteering to make the trip, there are so many ways to support Face-to-Face in its mission.
So lots of ways to be involved. Clearly, if you want to have an active role, we've set up this Ukraine task force within the Facial Plastics Academy. Karen Sloat is our administrator, and just reach out to the Facial Plastics Academy, and she can get you plugged in. That would be, again, we're certainly planning on additional collaboration, additional trips. So there's lots of need to continue what we started. And then, if you can't can't go. Clearly, financial support is always necessary for things like this to work and to succeed. And again, through the Facial Plastics Academy on the website, if you go to AAFPRS.org and you go to the humanitarian section, there's a section for Ukraine where you can make monetary contributions. So every little bit helps. And again, I highly encourage everybody to get involved. The whole experience was surreal, really. When we got to the hospital, the first thing that they do is they take you to the basement to their bomb shelter to show you what the bomb shelter is. But then they say, and we actually acknowledge this, that, well, what happens if we're in the middle of an operation? Are we all going to just leave the patient there and run down to the bomb shelter? That's not going to happen. And so that did happen, by the way. A couple of times, the air raid sirens would go off, and you all look at each other, but then you would continue because, you're not going to leave the patient on the table and run down to the shelter. So, thankfully, it was safe. I don't think we ever felt unsafe aside from things like that happening. And like I said, there was constant reminders of the war. When we crossed the border, there were this young group of Ukrainian soldiers who were going the other way to train in Europe. And so that was just a reminder of, how close that conflict is and, sacrifices these young men are making. It was definitely surreal, different from, a lot of the medical missions that I've participated in. But again, really the bottom line, incredibly gratifying in terms of being able to take care of these people who really would otherwise not have access to that skill set that we brought along with us. As I said, again, there's a lot of needs, so we certainly need to continue this collaboration. So I do want to mention kind of the whole bonding effect that you have on a trip like this. It's really emotionally a lot to go through, and so I think as a team we really bonded, all of our surgeons. So I do want to give a shout out to our team members. So Dr. John Frodel from Geisinger in Pennsylvania, again, he's the one who initiated this effort. Dr. Scott Tatum was up in Syracuse, craniofacial surgeon there, and Dr. Greg Maskovich down in New York City with Mount Sinai. His partner, a oculoplastic surgeon, Dr. Bruce Moskowitz. We had Luke Tomitz, a neurosurgeon, married to Maria Soroka from Rosem. We had Dr. Ivanka Niebuhr. We had the head and neck surgeons who partnered with us, Dr. Augustine Moscatello from the Westchester Medical Center, obviously myself, another surgeon who was born in Ukraine, Dr. Boris Chornoblovsky, who's also a head and neck surgeon down in the city. A neurologist, Dr. Glenn Castaneda from my area up here. The two nurses, Debbie Fritz and Sue Katijan from Healing the Children. We also had a surgical technician who works with Dr. Moskowitz and Dr. Maskovich, Lindsay Norito. So really, we had a great team. There was a couple of other Rosem members, Oksana Fonchuk, who was there as well, coordinating the logistics. Total team effort. And, we spent a lot of time together on that bus ride, 12 hours back and forth. It took even longer on the way back. We were stuck on the border, didn't get crossed till past midnight, didn't get into Krakow till, 3 or 4 o'clock. And people had flights the next morning at 6, so they had to go directly to the airport. And so people traveled 48 hours, so truly a bonding experience. Such a great group of people. That's really what makes me want to keep doing this kind of work, because we're so passionate about helping. And it's always such a bonding experience when you're with like-minded people doing this kind of work. The other thing to keep in mind is, there's no end in sight, unfortunately. And each day that goes by, there's more and more people suffering the same fate, with injuries. And so there will be a lot of need. And so efforts like this to collaborate and really help out, the patients, I think are critical.
To learn more about how to get involved with Face-to-Face, visit AAFPRS.org. Thank you for listening to this episode of Modern Aesthetics, the podcast. Listen to future episodes at modernaesthetics.com or subscribe wherever you listen to podcasts.